Hello everyone who's joined us, and welcome to our webinar, Beyond the Applause, Demanding Supportive Workplaces and Conditions for Our Frontline Professionals. We are here today with the 5 CEOs of the organisations that make up the World Health Professions Alliance. They are set as panellists, so you will see them on your screen, as well as the incoming CEO for the International Hospital Federation. So welcome to you all here. Before we get started, I wanted to go over a few housekeeping rules. Firstly, my name is Helen von Dadelszen, and I am the manager of the WHPA Secretariat. For this webinar, your cameras and microphones will automatically be turned off. So you will only see the photos and videos of the panelists. If you want to ask a question at any time during the webinar, please use the Q&A button, which is at the bottom of your screen, and we will manage those as they come in and at the end. If you do have any technical problems, please write an email to info@world.physio, and our colleagues there will be able to help you. The session is being recorded, and we will make the recording available following the webinar. And I would just, before we get started, I wanted to launch a poll to see where you're all coming from. So we have 2 questions. The first one is, what region of the world are you currently in? And the second question, very simple, is what's your profession group? And we're very aware that these are broad categories of professions, but if you can just let us know what profession group you recognise yourself fitting into, then we can see who we have on the call. I will hand over to Howard, who is the CEO of the International Council of Nurses. Howard.
Helen, thank you so much, and good afternoon, good evening, good morning. Welcome to all of you to this World Health Profession Alliance webinar to relaunch our Positive Practice Environments campaign. My name is Howard Catton. I'm a nurse and I'm the CEO of the International Council of Nurses. For those of you who don't know who WHPA, the World Health Professions Alliance, is, it's an alliance of the World Dental Federation, the International Pharmaceutical Federation, World Physiotherapy, and the World Medical Association, and ICN, the International Council of Nurses. And I'm delighted that my colleagues and friends, the chief executive officers from those international organizations are joining us. Catherine from FIP, from the Pharmaceutical Federation, Enzo from the dentists, Jonathan from the World Physios, Otmar from WMA. Thank you, Otmar. Everybody put a camera on and give a wave to everyone. And our very special guest. All good webinars have to have a very special surprise guest, and that's Ron Lavater, who has recently taken over as the CEO at the International Hospital Federation. Very good to have you with us, Ron. WHPA was formed back in 1999, very deliberately to support collaboration amongst health professions and major stakeholders. We work together on guidance, on advocacy issues, on ensuring that the health professional voice is heard, not just at WHO, but a number of the other really important international organizations. We often hear people talk, don't we, about the importance of multi-professional, multidisciplinary working, and I'm very happy to report that that is very much alive, well, and kicking internationally through the WHPA Alliance. So why are we relaunching our Positive Practice Environments campaign? COVID very much, colleagues, has been a key driver as to why we think now is absolutely the right time to relaunch this campaign. All of the international health professions associations have been very concerned from the outbreak, from the start of this pandemic, about the health, safety and well-being of healthcare professionals, of our members. Right back at the get-go, just weeks after the pandemic started, we actually wrote as an alliance to the G20 leaders to explain and set out concerns we were picking up then about the lack of supply of personal protective equipment. We have seen over the last months the huge pressures, demands that are being placed on healthcare professionals right the way around the world, not just on their physical health, but also their mental health, their psychological well-being. And I'm sad to say that all of us have also picked up some outrageous, dreadful examples of attacks and discrimination against healthcare professionals. And of course, we believe absolutely strongly that the rights of healthcare workers to safety at work, to protection, to decent work are fundamental, and we advocate and campaign very strongly, very strongly for those. But we also know that we can't keep patients safe if we don't keep our health workers and our healthcare professionals safe as well. There is now overwhelming evidence about the relationship between the two. And this year, WHO, with the support, the encouragement for WHPA, put health professional safety alongside patient safety as two sides of the same coin. And that's a really important message, and the charter that WHO have been promoting, we have been supporting as well. Not all places around the world, colleagues, even recognise that COVID is an occupational disease, and that's been one example of an issue that we as an alliance feel is absolutely fundamental and strong. But we also know, colleagues, don't we, that there's a huge shortage of healthcare professionals around the world, in the region of 18 million. Across all our health professionals. It's a very salutary reminder of the lack of preparedness that we went into this pandemic, 18 million healthcare professionals short. And positive practice environments are therefore also hugely important, not only to look after the workforce and retain people that we have, but also to make sure that our professions remain attractive to people who might want to join us in the future. So in a nutshell, colleagues, those are the key reasons why we are relaunching this campaign. And I hope I've also covered the definition of what positive practice environments is. Of course, it's about decent work, but it's about retention and retaining. It's about patient safety, satisfaction. And we very strongly believe that positive practice environments are also the most cost-effective way to ensure and deliver our health systems. So this afternoon, we're going to hear from the front line, from Darren Brown, a physiotherapist from the UK, to bring us his perspective. And then my colleague Catherine is going to run through the campaign materials to take you through all of those. And then we're going to conclude with a question and answer session. So please do use the Q&A tab. We'll be monitoring that, and we'll come to those questions and answers at the end. And I know that my chief executive colleagues will want to answer questions, and will have views that they'll want to share with you as well. So that's our plan for the next hour, the next 55 minutes that we have together, colleagues. Helen, I'm going to hand back to you.
Thank you so much, Howard, for that warm welcome and the framing of the conversation today. We actually have, as Howard said, a very special guest. His name is Darren Brown. He is a cisgendered gay white man of English and Irish heritage living in London, UK. He's a clinical and academic physiotherapist specializing in the field of HIV, disability, and rehabilitation. Darren leads the HIV rehabilitation service at Chelsea and Westminster Hospital NHS Foundation Trust. Darren contracted COVID-19 in March 2020 and continues to live with long COVID. We're so grateful to have Darren here with us today to tell us his personal account of the occupational hazards that health professionals face at this time, as well as the importance of having supportive work environments. Welcome, Darren.
Thank you for having me, and thank you for the introduction. So yes, as mentioned, I am a physiotherapist and I work both clinically and academically. I did contract COVID-19 acutely in March this year. And I was fortunate that after my acute episode that would have been classified as mild because I was not admitted to hospital, I was able to return to work after 10 days. I returned to work and I remained in work for 6 months. And during that time, I was redeployed to intensive care, working on acute medical wards outside of my usual environment. And during that time, I continued to have some symptoms, predominantly fatigue. I didn't realize that that fatigue was possibly a consequence of having had COVID before, because we were working in the middle of a global pandemic and we were all working really hard. And I had no idea that maybe that fatigue I was experiencing could be a consequence of COVID. However, at the 6-month mark of returning to work, this fatigue became overwhelming. The fatigue became so much, I was unable to walk properly. I was unable to do my usual activities, and I wasn't able to continue working. And now, as I sit here today, I'm officially 2 months having not been at work. During this 2-month period, my disability that I have experienced has been multidimensional and episodic in its nature. For example, some of the symptoms and impairments that I've experienced have been overwhelming fatigue, post-exertion malaise, whereby exertion that can include physical, cognitive, or emotional exertion can create a level of fatigue 24 to 48 hours later that is incredibly overwhelming. I've had pains in my bones, in my joints, in my muscles. I've had problems with my thinking, so my cognition's been impaired in terms of my memory and processing. Over this 8-week period, I've gone from being bedbound to housebound, to having to walk with a walking stick, to being able to hopefully get to the point of getting to the park. Over the last few weeks, I'm no longer walking with a walking stick. I'm performing my activities more independently. I'm shopping for food independently, and I'm not dependent on my partner to make me meals anymore. And fortunately, as of today, I am very grateful to be able to say that I'm going to be starting a phased return to work from next week on Monday. Now, it's a huge milestone for me because this journey has been really quite traumatic, actually. I contracted COVID-19 through my employment. I was working on a ward and there were patients with COVID-19. I didn't realize how much it was going to affect me in the long term. But what's enabled me to recover is a positive practice environment, whereby my GP was able to sign me off, giving me the opportunity to stop, rest, and pace, so that I had the opportunity to recover. And that time that I've been afforded by not being at work has been imperative to my recovery. And this positive practice environment continues, whereby I'm now being afforded the opportunity to have a phased return to work over a 6-week period. And at no point during this time has my employer pressured me or put any undue strain on me to return to work, and have given me every opportunity to stop, rest, and pace, and engage in my own rehabilitation during that time. I know that long COVID is something that is very variable for many people. And some people have been experiencing the disability associated with long COVID since they contracted acute COVID-19. I was very fortunate that I was able to return back to work. However, maybe I pushed it too hard and I didn't know I was pushing it. And so in terms of my pacing, I'm also having to learn to plan and prioritize, but most importantly, I'm having to learn to be precautious of my health and my well-being so that I can return back to work. I do still have some slight challenges. I'm noticing my memory is not like it used to be. So this is something that I'm hoping will continue to improve. But as a very motivated person, I know that going back into work and pacing myself is going to be challenging. So I'm really emphasizing my precaution, because I need to be precautious that I don't push myself in my excitement of returning back to work. I'm very happy to receive any questions about my experience, whether that be about my symptoms, whether that be about the experience I've had in terms of my employment or even my phased return to work as it's soon to commence. So very happy to receive any questions from anybody, including in the Q&A function that is available.
Thank you so much, Darren, for sharing with us your really powerful and emotional story. I can't even imagine how challenging it's been for you not to be working over these last 2 months and the frustrations you must have felt over this time. Just before we kick off the questions, maybe some of the CEOs have for you and other people in the audience, I wanted to ask if you were given the opportunity to give one message to other health professionals, having had your experience, what would that message be?
Good question, and thank you for it. I think the first would be to recognise the potential signs and symptoms of long COVID. We've seen from the data and the evidence that's emerging, trying to categorise and measure the experiences of people living with long COVID, that fatigue is an overwhelming experience, but it's not the only sign and symptom, because long COVID is presenting as a cluster of symptoms. I think if any colleagues, friends or family are experiencing fatigue during this time where the risk of occupational fatigue or burnout is so ripe, I think it's incredibly important that we recognise that sign and symptom, and that we enable staff and colleagues to manage that fatigue, first of all, through its recognition.
Great, thank you, Darren. We have a question from Angelique. She wants to know, are you using any supplements?
I am using supplements, actually, and I know that there's a lot of suspicion around supplements. I was advised by a friend who is living with ME, chronic fatigue syndrome, who said that in the majority of chronic fatigue services in the UK, the services advise people to take coenzyme Q10. I have been taking that, and actually I've been taking that since the day I was signed off work. And I won't lie, it was about 4 weeks in, I felt like a light switch was turned on and the fog lifted. And since that point, things have improved. It's very difficult to know whether the supplements are actually contributing to that, because there are so many variables in my journey. First of all, not being at work, being able to rest, recover, pace. But that has been something. I have tried other supplements as well. I don't know that any of them have worked, however. But good question, thank you.
We have another quite technical question. How do you gain back your pulmonary endurance?
Oh, wow. Well, I haven't experienced too much breathlessness. So during my acute phase, I was breathless to the point where in March, for the first 48 hours of acute COVID-19, I was breathless rolling in bed. However, during my long COVID phase over the last 2 months, when the fatigue and the post-exertion malaise was at its height, I would get breathless because I just had no energy. For example, walking down, I live in a second floor flat and there's no lift. So going down the stairs was beyond effortful, and I would be breathless and have to sit on the stairs, and I couldn't get up the flight of stairs. How I'm moving forward with that is difficult to navigate, because usually as a physio, I'd be thinking about doing a graded exercise program to try and improve my cardiopulmonary fitness. However, exertion can actually create post-exertion malaise. So therefore, that's been a really difficult thing to navigate. And at the moment, my recovery has been trying to return back to usual functioning in my day-to-day life, rather than engaging in specific cardiopulmonary exercises. I look forward to being able to be active again and doing those things, but it's taking it a step at a time. And for me, that's getting back into work and seeing what work looks like first before I start trying to be more physically active in terms of exertion and exercise.
Thank you. We also have a question from Susanna. She firstly says, thanks for the great presentation. And she wants to know, what advice would you give for those who have contracted COVID previously and are now trying to go back to work just like you are?
I think I've been hearing lots of stories of people that are scared to speak to their employers about, or their managers and line managers about the symptoms that they're experiencing. Mostly because of the desire to continue to work during this time, the sense of camaraderie amongst the health professionals to continue to address this global challenge that we're experiencing. And I think my advice would be that we need to put ourselves first to be able to give the best to our patients. And so if we are experiencing symptoms that may or may not be related to, for example, long COVID or things like burnout as well, I think we need to be recognizing them ourselves, being kind to ourselves to be able to raise them. And then also hopefully with our employers and our managers, being able to have constructive conversations about how to manage these things and hopefully prevent people crashing like I did 2 months ago, by pushing through, by not recognizing the symptoms, associating them with long COVID, and therefore not being able to mitigate the further disability that I experienced because I pushed through.
Thank you. We have a question from AD who wants to know what, if you think you will suffer future symptoms related to COVID, or maybe no one knows. What have you been told about that?
We don't know the long-term consequences of COVID-19, do we? Like, we're still living and learning this. I do not know what the future holds for me. That, for me, creates uncertainty and worrying about the future. That's why pacing is so imperative for me. And that's pacing not only in my physicality, in terms of my physical or cognitive or emotional exertions, but also in the activities that I would usually do in my workplace environment, thinking about appropriate adjustments. I hope that I don't have another relapse. However, I am hearing stories of people that have relapsed after a certain number of months, after feeling like they had recovered with long COVID. So I think it's, again, being kind to ourselves, recognizing how we are feeling and addressing the signs and symptoms as soon as we can find them.
Okay, I'm going to combine a couple of questions here, one from Chaz and one from Pablo. Chaz asks if you believe that your work is providing a positive working environment, and I sense that that is the case. And Pablo adds on to that saying, it sounds like you had great support from your manager. How do you think it would have been had you been in a non-supportive environment? How would that have impacted your recovery? Because I imagine there are other people in that situation.
So yes, I have had a positive practice environment. As I mentioned earlier, I have not been pressured to return to work. I have not had additional stress put on me during this phase of recovery. And I have been given every opportunity to stop, rest and pace. And now that continues with a phased return to work. If I hadn't have had that environment, in response to the second question, I have no idea that I wouldn't be sitting here having a conversation with you now. My disability was so profound at points that I struggled getting out of bed. I struggled navigating my usual activities, such as getting washed and getting dressed, preparing meals. And at my worst, I couldn't read. I wasn't able to process things like words on a page. So if I hadn't have had a supportive practice environment, I have no idea what my health would be like right now. And I worry for the many people that aren't able to recognize the signs and symptoms, or have people that can support them to recognize those signs and symptoms of long COVID, to address them and therefore mitigate increasing disability.
So maybe this final question from Angelique nicely wraps up your section of the webinar. What do you think about the guideline from WHO that after 7 days, healthcare workers can go back to work?
I think that's dependent on people's own personal circumstances. I don't know that I could have returned to work after 7 days. When I got back to work after 10 days, I was still breathless walking down the street. And apparently I was mild because I wasn't admitted to hospital. So I would say that it's great to have guidelines. However, there needs to be person-centered care for our healthcare professionals. So therefore, if 7 days is not within the time frame of a person to be able to recover and successfully return to work and be able to be in that employment safely, then that's not an appropriate time frame. If it is for others, fantastic. But I think, again, we all champion person-centered care for our clients and our patients. And I think we need to be starting to do that with ourselves.
Brilliant. Thank you so much, Darren. So what I take is rest, recover, and pace. Right? That's the recommendation from you. Great. Thank you so much for your time today. It was really powerful to hear your story, and your fielding of those questions was really useful for all of us. Thank you so much. I just wanted to see if any of the CEOs wanted to ask one last question before we move on to the next section of the webinar. Otmar?
Not really a question, just a comment. I think that really shows how important it is that we also have to be self-reflective on our own health, and how important it is that our own health has to be there and has to be restituted if in danger, in order to provide really high-level care. Without that, it's not possible. So that's not selfish. It's not self-serving. It is really important for serving our patients. Thank you, Darren, for this wonderful story.
Thank you.
Thank you, Otmar. Anyone else wanted to say a final word before we pass the baton on to Catherine? So Catherine, I'll share my screen again so you have the slides. Okay, over to you.
Thank you so much, Helen, and thank you, Darren. I actually had 3 reflections on your story. One was just the level of empathy you were able to share with us today, and I thank you for that. I think there's something about a story that brings an experience so to life, and we should recognise that we're patients in this journey as well, as Otmar has said. Understanding where we are in the global journey means we're only just beginning to understand this disease at all. And this will help us pace not only our professional responses, but our professional responses as well. So it's super exciting to be here today with everybody to launch this campaign during a very difficult time for us in all our different countries and globally. And I really wanted to just walk you through how to get involved. I'm going to spend a few minutes going through slide by slide what we mean by positive practice environments, and then some of the resources that we have. So my first question would be, what is a positive practice environment? And we at WHPA would describe that as a healthcare setting that supports excellence and decent work conditions. And we heard from Darren just how impactful that has been on his peace of mind and his return to work. Good luck, Darren. This has the power to attract and retain staff, to improve patient satisfaction, safety and health outcomes, and actually to deliver cost-effective, people-centred healthcare and services. So next, when we think about standing up for positive practice, what do we mean? Standing up for positive practice environments is our campaign initiated by our alliance that aims to improve the quality of healthcare workplaces by, firstly, drawing attention to the scale of the problem. Secondly, increasing our understanding of what a positive practice environment is, whether it's healthcare settings that support excellence and decent work conditions. Thirdly, advocating for positive practice environments and related changes in policy and practice to reach it. Fourthly, identifying and sharing good practice. And we've just heard a great story today. We probably need to do more of that. Next, providing tools to help the implementation of positive practice environments. So where employers want to step into this space, we can support them. Next, to urgently action from health professionals, managers, governments, policy and decision makers, and community leaders. And COVID really has heightened the need for us to do this, as we've heard today. Materials have been developed to support these objectives, and I'll now spend a couple of minutes introducing you to those. So firstly, we have a website, and here we host all the materials in English, French, and Spanish, and this is accessible to all. Next, we have a campaign booklet for national member organisations, because we do understand there's a need for adoption and adaptation. The booklet explains the campaign and a toolkit to national health professional associations and organisations. So they are empowered to activate the campaign at a local level with their members, the media and governments, and we can support them with that. Next, we have a campaign booklet for health employers, managers, including human resources departments and health professionals. We know everyone has to be supported to play their part in positive practice environments. The booklet explains the campaign and the toolkit and aims to inspire health employers, managers and health professionals to use the materials. It encourages communications between managers and staff at health facilities and essentially to help galvanise action at a local level. Next, we have fact sheets, and these provide background information on what a positive practice environment is, what an effective incentive system is, why they're important, and the importance that health professionals have access to healthcare information. We do record today, so hopefully everyone will have access to Darren's story, and that will impact even more. Next, we have a set of posters. There are 6 of these created to provide information about the need for positive practice environments, as well as what a positive practice environment is, the elements which encourage health professionals to stay in their employment, and how to turn healthcare settings into these environments, the importance of effective incentive systems, and why health professionals need healthcare information themselves. As we've heard, it does take a time to move from being a healthcare professional focusing on caring patients and understanding that you may be a patient yourself. So we need that information. Next, we have an action list which outlines the steps needed and the considerations required to turn healthcare settings into positive practice environments. Next, we have a set of social media tiles, and these are small bite-sized pieces of content that can accompany social media posts. They really help to summarize and relay information quickly on social media platforms where you only have a few seconds to get your message across. Next, we have a template press release, stand up for positive practice environments, and answer to the growing gap between supply of health professionals and the demand for their services. And this can be adapted to the needs of those who need to use it. And as Howard mentioned, the health professionals across the world entered this COVID pandemic 18 million short of a full capacity. And now we find ourselves managing the pandemic with our patients and the public almost with a much diminished workforce on top of that. Next, we have materials available for download. And again, these are in English, French, and Spanish. So, colleagues, now really for the call to action to all of you, the call for solidarity. Now it's your turn to get involved. How will you stand up for positive practice environments? For example, you could share our social media posts, you could download the materials, share your good examples, your initiatives, but also your concerns. You can put up the posters, you can talk about the campaign, you can ask questions. We realise at the moment most of us are living virtually, so the campaign will run until May 2022, which gives us enough time before we hold our health regulations conference. One of the main themes of that conference will be the lessons learned and the best practices brought forward through this campaign. So we want your views, we want your inputs, and we want your examples. We're looking forward to having you to stand up for positive practice environments with us. Thanks a million. Thank you, Helen. Thank you, the audience. And once again, thank you to Darren.
Thank you so much, Catherine. So we recognise it's a lot of information in a short period of time. What I recommend is people to go on the website, www.positivepracticeenvironments.org, and you will see you can click through to the French version, the Spanish version, and even a limited Japanese version. Thank you for who put that together. And there you can read more about the campaign. You can download all of those materials that Catherine has just presented to us. And if you have any questions, you'll have our contact details there as well. Thank you, Catherine. Now I'd like to hand back to Howard, and we see what questions we have from the audience today.
Helen, thanks so much. Catherine, Darren, thanks again for wonderful introductions and setting out the materials. So colleagues, if you've got questions from anything that you've heard about the campaign or where we're going, please do put them into the Q&A tab. I think this is the only occasion where I have seen a panel of all of our chief executive officers from the health profession. So this is a very unique opportunity, not one to be missed. So get your questions in now. But I'm gonna start by asking my colleagues that we're clearly seeing surges of the virus in a number of places, particularly where we happen to be speaking from here in Europe. And I think all of us are hearing stories of pressures being put on healthcare professionals to go back to work because of the shortages, because there aren't enough people, because of the increasing demands. So I'm interested, what's the advice from our chief executives about how you deal with that pressure to return to work where health services are stretched and are thin? And Darren, I'd be interested as well to get your take on this as well, as to whether I've sometimes heard that sometimes from a health professional's point of view, there might be a sense of guilt about not going back and helping out your colleagues. So your view on this would be great to have. Jonathan, I'm going to come to you first because you've keenly turned on your video. Jonathan.
Thanks, Howard. I think that particularly as a CEO group, we were really talking about this quite a lot in the beginning of the pandemic when the issue of PPE came up. And that really, I think, highlighted for me that sort of ethical dilemma of if a workplace is not providing appropriate personal protective equipment, to what extent is it still ethical for health professionals or to withdraw their service if they're not being provided with a safe workplace? And I just think it's just one of those incredibly difficult things which, I would support anybody who is withdrawing their service, but equally, I'm not going to condone anybody who feels compelled in their situation to continue to work. So we've had situations from World Physiotherapy's perspective where we've provided support letters, advocacy to member organisations so that they could argue the point one way or the other. But it's not an easy decision, and I think culturally it's so ingrained in us to be, continue to go to work, stiff upper lip and all that sort of thing, depending culturally, if that's something that resonates with you or not. I'm sure there's equivalent sayings in other languages, but I'd actually be interested in Darren's perspective from a frontline worker, how you grapple with that, the ethics and the moral and the culture of a workplace around attending, not attending, particularly if it's unsafe.
Jonathan, thanks very much, and definitely, Darren, want to hear from you in terms of what that feels like and whether there are, is there any guilt that staff may have and duty that they feel they have to others? But you said very, very strongly as well that your advice was, you need to put yourself first. What are your thoughts, Darren?
Varied, actually, but a really important question, because I think during my 2-month period of not being at work, there have been periods where I've been so unwell that there was no contemplation of even being able to return to work. I couldn't get out of bed. How could I work? However, as I sit here now, I feel ready to return to work. I think that, as Jonathan said, many health professionals are incredibly eager to respond, and whether that is layered with a sense of guilt of not responding, we have heard. But I think that I can only speak for myself. I can't speak for others. But in my experience, I haven't felt guilty by not being there because I had to put myself first. But that is a very unusual circumstance for me to not be at work and not be responding to everything that is available to respond to. So for me, moving forward with a return to work program, that's going to be the next challenge of how do I pace myself when everyone else is not on the same trajectory as me.
Darren, thanks very much. I want to come to Otmar and Enzo, we're this pressure that people are under as a result of the second wave and the surges that we're seeing as well. We're starting to detect a little bit of a mood change amongst some of our nurses, and I don't know if this is the case with the doctors and with the dentists as well, who frankly may be feeling a bit fed up with the applause and the accolades, and are saying, now is the time for real action. Some parts of the world that we're aware of where there are protests, there are demonstrations, there are potentially strikes happening as well. What do both of you, what's your sense of the temperature at the moment and the mood, and whether that's changing? Otmar, to you first.
Thank you, Howard. I think this is a very important question, and what we have seen is indeed a little bit of change. While in the beginning everybody was absolutely overwhelmed with the avalanche that was rolling over the healthcare systems, and everybody, I think, did his or her best in order to help and to be there as good as they could. There was a lot of reflection about what is the work environment we are in right now. Certainly, this is very different from rich settings to poor settings, where sometimes nothing was there. And of course, then it's very difficult really to help. But even in the rich countries, in the affluent countries, it came to a point where we had to realize that our healthcare structure, our hospital structure, was actually not built for the pandemic. We had wonderful pandemic plans on paper, but when it came to really the reality, there were a lot of gaps. From the supplies, whatever it was, not only PPE to instruments to medicines, it didn't work. From the staffing was always kept marginal to just deliver in time, but not more, for nothing else. And we have seen shortages of physicians, of nurses, of physiotherapists, of all the people working together in these intense settings there. That became very clear that our healthcare system has been, in nearly all parts of the world, have been grossly underinvested, and in especially those countries which were under austerity measures over the past, and we have seen this very clearly in the numbers in Europe, for instance, they have suffered most from that. So what is now the disappointment is that, and many colleagues have gone on the street and have protested. What the disappointment is that nothing changes. Mm-hmm. I mean, we have understood that the way of financing hospitals just to this little margin that they have is wrong. Is there any change? No, there is no change. We have seen that there are big shortages in staffing. Nursing, for instance, in my own country, in Germany, understaffed. The answer is very clear. You have to give a better pay in order to make this job more attractive. Material is there. That's not the problem there, but it's not attractive enough. Is there change? Not really. A little bit, but nothing really meaningful. So yes, there is disappointment about that. That does not mean that any of those health professions is not absolutely committed to give their best right now, and they do so again, and it's an overwhelming work that is still on them, with all the delayed services which came still in during summer and now still in fall, of all the treatments that have not been applied, that have not been given in spring because the hospitals were basically closed for anything else but COVID. But still, there is a very clear understanding now, yes, we have not done enough, and we still need much more attention to that healthcare system. The healthcare system is not just about just-in-time services and lean services, as you can build cars like that. Nobody suffers if a car is not ready today and only tomorrow. Healthcare is about being able to deliver just in case. And that is what we're experiencing right now. Thank you.
Otmar, thanks so much for that. And I think it's a segue. Enzo, I'm going to come over to you, because more of the people who you represent are more likely to be working on their own or in smaller teams. So we might think, well, that makes it easier, doesn't it? Dentists are in greater control to decide what is a a positive practice environment. So your perspective on what it looks like for dentists, and I'm also, Enzo, Otmar was starting to pick up this point as well about, not only are people got, COVID needs, but there are all of these other healthcare needs that we're worried about that people are getting sick with, but are they accessing healthcare? But if you've got an abscess on your tooth, that's something that you're very, very unlikely to want to delay. You really need to go. So give us paint a picture of what it's been like for dentists.
For the dentist, at the very beginning, we didn't know. All of us, doctors included, so there were big question marks on the severity of all this. But the dentists from the very beginning have been locked out of the equation, and all the dentist dental practice have been closed down. And when you know that the dentist infection control is just a daily routine, so what they had to do is really to adapt our PPE and so on. But the frustration is that they were not even asked at the beginning. Is that how do you manage infection? So can you participate to the discussion? Or again, I say at the beginning we didn't know, but now we know, and we know that in dental practices, there is now we have the studies that show that there's no COVID infection, and if there is a COVID infection in a dental practice, it comes from a healthcare professional that was partying the day before. So the dentists have been hit tremendously because they had to close their dental practices. So, but it's true that we cannot compare a hospital to a dental practice, and it's probably easier to have a positive a PPE, a positive. How can I say in English? You can apply this into a dental practice much easier when you are 6, 7, maximum 10, even clinics. Dental clinics have probably 20, 30 people versus a hospital where you have a whole structure, the administration, you have many more people. It's more difficult to apply. So dentists were frustrated. Now they're happy that they can show that they can manage this as they could before. They were not asked. So we should think about it. Each profession, health professions has some strength, and infection control is a strength within the dental practice.
Very well made, Enzo. Catherine, interesting to hear Enzo's perspective from dentists. Without being flippant, Catherine, I think this pandemic is the first time I've seen people queuing outside of pharmacists, not just for masks, but for paracetamol, but for advice. There's a sense that and I don't know your take on this, your perspective on this, but the pandemic is perhaps making people to realise the underutilised potential of pharmacists and of pharmacies as well. Is that something that you're seeing?
Oh, we've seen this absolutely, Howard. I mean, second to none. There's two things though. On the front line, we've got pharmacists who work in hospital. So I empathise very much with the comments that we've had from physiotherapy, nursing, and from medicine about just the tsunami of health needs and then the lack of preparedness across our hospital sectors. But then we also have pharmacists in community. And the interesting thing there is that there's quite a lot of lessons to learn or to share with our dental colleagues. A lot of these pharmacies are small and single-handed. And the thing here is that most of our governments are now realizing that if they need pharmacies so much at a time of a pandemic, that they're going to have to think about pharmacy in the community as an integral part of the health system. And many of these pharmacists, especially in the independent sector, they equipped and kitted out their pharmacies with all of the signage and the PPE and, made sure it was a safe environment for patients, but they invested in that in themselves. And I think that's I want to just draw the parallel with investment in your environment, as well as investing in your staff from an individual perspective, is possibly more of an investment than from a big institution. And I think that's what dentists have been allowed to do recently. As far as your point about have they demonstrated their potential? Yes, because, you know, pharmacies stock and store so much medicines, and they've been able to keep the supply chains going and fluid. And I think that perhaps have never been noticed. But also, you know, with the ibuprofen scandal, don't take ibuprofen, there's a risk, and the sudden tsunami of paracetamol use, pharmacists being able to myth bust and to support patients with inquiries about all of this whilst seeking the best advice themselves so that they're spot on, has been a real need. And I think there's really two things to take from this. Our governments really need to know the place and position and contribution of all the health professionals who give of themselves without even thinking very often. And that can be materially seen in the community pharmacy environment when you have a small independent pharmacy. But also the second wave has two big impacts. We had last winter, then spring was COVID, and then summer for health professionals has been catching up while we had a bit of a brief respite in the Northern Hemisphere. And now we've got COVID again. And I have colleagues and friends who are health workers who've got like 2 months extra of annual leave, and they've been doing overtime all of that time. And they may not have had COVID, but you know, people are exhausted, and we know the public are exhausted. And then my final thought, Howard, was we're looking at Darren and taking from him that he's a patient while he has COVID. We should all realise that we're professionals, but also we're people, and we're all fatigued with this pandemic, and that's something to remember as well. So they're my reflections. I think in a way pharmacy sits between the colleagues who work in hospital and community. And of course we've got, you know, the academics, and we've got the industrialists, and we've got the others as well, but the frontline colleagues experience both of these, and I'm sure nursing has the same sense. People threw themselves at this pandemic without thought for themselves, and we should commend every single one of them.
Thanks, Catton. And again, the point about investing in the environment as well as staff, hugely well made. There was also a question I'm not going to ask you to respond to, but somebody flagged the key role that pharmacists will also play in terms of post-COVID, people who are suffering from post-COVID symptoms as well. Ron, I'm going to come to you in a minute, but just to say to all of you, I am going to ask all of you for just, you know, a one line, the most important thing that could be done that you would do in terms of promoting positive practice in environments. I'm going to give you all 30 seconds in a moment. But before I do that, Ron, you might be the new boy, but I'm not going to let you off, because it's down to your people, Ron, isn't it? You know, if your people pull this together, put safety of staff and health workforce bang at the centre of what they did, you know, your leaders, your members could solve this in an instant. A deliberately provocative question, Ron, to let you come back and give me the view from those colleagues who are running hospitals and health systems.
Well, thank you, Howard, for allowing me to join this group and hopefully add a little bit. We just spent the last 2 days in a digital conference with 400 plus healthcare executives across the globe, mostly hospital and health system leaders. And what we heard through many of the discussions, many of the forums, is that during the first wave of COVID, the shortage of PPE and equipment, or even physical capacity, the NICU beds, the ventilators, you know, all that has been greatly advanced. I don't want to say solved everywhere, but it's been greatly advanced, where that's not the problem in the second wave. The second wave is down to the personnel. And so the best organizations that we heard from around the globe are trying very hard to have many of the aspects of the positive practice environment that you've talked about as part of what they're trying to do and ramping it up. Because really, to survive the second wave and the third wave in this long term, it's the people, it's the healthcare givers, it's the healthcare providers that is going to be the linchpin, and as well as the breaking point. So it's healthcare is a people business, right? We're people taking care of people, and the best hospital executives have recognized that and are starting to put in different plans and programs, varying degrees of success, but at least the ones that we heard from that are leaders, they absolutely are addressing that, because they see that because this is going to be a long haul disease for us around the globe. So hopefully the healthcare executives that we deal with, and we're continuing to push out that message about the work that your organization has done. But I will tell you, we heard some very good stories. Dr. Ottma was on a lot of it yesterday and the day before of the hospitals realizing that that's the linchpin, is supporting the staff. And finally, I'll say that as a former hospital executive, I also recognize that it's a calling to work in the healthcare field. There's a lot of jobs that people can do, but when you get into healthcare delivery, when you get into the hospital business or healthcare delivery, it is absolutely a calling, and we've seen that globally.
Ron, thank you so much for those wise words and reflections. And Ron, to be fair to you as well, it's great to have you on board. But before we met you, one of the things that I had heard about you was your personal commitment and leadership around safety as well. So just wanted to recognise that, and really, I think all of us are looking forward to the work that we can do in the future. We're running out of time, so CEO colleagues, please, your final thought on what's the most important thing that we should be doing, and now keep it short if you can. But I'm going to come to each of you, and Darren, I'm going to come to you last for final word as well. Jonathan, to you, your final thought.
Thanks for that, Howard. I think it's been a great session today. And my point to leave on would probably just be to just give everybody the permission to be kind to ourselves during this time. That this is not a sprint, it's a marathon, and we all need to take care of ourselves. And so to model behaviour of ourselves that we want others to model, I think is really important. So Catherine mentioned taking leave in the coming weeks. Let's all just make sure that we take the time off and look after ourselves, because we're going to be in this for a long haul, and I think that's one of the best things we can do in terms of creating a positive practice environment for ourselves and the people that we work with.
Like all good chief executives, Jonathan, you got 4 or 5, I think, in there in your one final point. Ottmar, your final thought.
Yeah, let me just combine this with answering a question that has been brought up by Carla. It is very important to understand that this is multidimensional and is really a program that aims not only on poor but also on rich countries, because if the situation for us, for health professionals in the rich countries is not proper, we have attrition there. It starts a pull factor. It deteriorates the situation in the poor countries where healthcare workers are being taken away, health professionals are being taken away. So we have to be very aware this has a macroscopic dimension. It has also the one on our personal level in working with each other in a healthcare setting, a communication aspect that we have to deal with, a very local one. So these different dimensions, I think we have to keep in mind and have to look to when we are looking for better work environment for all health professionals. And I think the people deserve it. Thank you.
Ottmar, thank you. Enzo, your final thought.
So I would say that allowing positive practice environment will allow the best delivery of healthcare. So, and I would encourage everyone to go to WHPA website to look at the very well done and resources.
Thanks, Enzo. Thanks so much. And Catherine, to you.
Simply put, Howard, I would suggest that a positive practice environment investment delivers you a positive people experience. And that's what we should do as employers and as health professionals who are in positions of leadership, to make sure our health professionals are supported to deliver for patients and public.
Excellent. Healthcare professionals are the best buy for healthcare for people. Darren.
Yeah.
You, sir, your final thoughts.
I would say that the long-term consequences of COVID-19, or also termed long COVID, are very real. And we need to recognize them, not only the implications on the individual, but in terms of organizational workforces and also society. And so therefore, this positive practice environments policy is incredibly important.
Brilliant. I think if we were to put all of those final thoughts together, we have the next WHA position statements. Talking of which, just so that everybody is very aware, the reconvened WHA starts next week. And for those of you who don't know, one of the other things that WHPA do is to intervene collectively as WHPA to make interventions, and we will be doing that next week as well. And the person who I'm going to hand back to, who's also been, as our secretariat has been leading that, is Helen. So my panel, thank you very much for your insights, your wisdom, and your time. Helen, back to you just to close this out.
Thank you so much, Howard. Very professional facilitating there. Thank you for all the panelists for your interventions and for simply being here and being part of this campaign. Thank you to the attendees as well. I hope you found that useful. It doesn't stop here. Please join us and stand up for positive practice environments. Go to the website. I've just put it in the chat, and there you will find all the information. This campaign is dead without you. We all see the importance of positive practice environments to support our healthcare workers as well, and health professionals, as well as, in the end, people. So please join our campaign, join us on social media, share with us your good practices, reach out to us. We look forward to hearing from you really soon. Thank you so much for your time today.
Thank you.